Hello friends, in this video now I am going to talk about hemorrhagic disorder. So the disorders associated with abnormal bleeding inevitably stem from primary or secondary defect in vessel walls, platelet or coagulation factors, all of which must function properly to ensure hemostasis. The presentation of abnormal bleeding varies widely. At one end of the spectrum are the massive bleed associated with rupture of large vessels such as the aorta or of the heart, aorta or of the heart. These catastrophic events simply overwhelm the hemostatic mechanism and are often fatal. Diseases associated with sudden massive hemorrhage include aortic dissection and aortic abdominal aneurysm and myocardial infarction, complicated by rupture of the aorta or the heart. At the other end of the spectrum are subtle defects in clotting that only become evident under condition of hemostatic stress such as surgery, childbirth, dental procedure, menstruation, or trauma. Among the most common cause of mild bleeding tendencies are inherited defects in bone relevant factors, aspirin consumption, and uremia, renal failure. The latter alters platelet function through uncertain mechanism. So, how uremia causes hemorrhage it is unknown. Between these extremes lie deficiency of coagulation factors, the hemophilias, which are usually inherited and lead to severe bleeding disorder if untreated. Additional specific examples of disorders associated with abnormal bleeding are discussed throughout this book. The following are general principles related to abnormal bleeding and its consequences. First of all, defects of primary hemostasis, platelet defect or bone Willebrand disease. The defect of primary hemostasis, platelet defect or bone Willebrand disease often present with small bleeding skin or mucosa. How bone Willebrand disease occurs? We have already discussed. It is caused due to deficiency of bone Willebrand factor. You can remember from first lecture of hemostasis. These bleeds typically take the form of petechiae, minute 1 to 2 hemorrhage, or purpurea that are slightly larger, that is greater than or equal to 3 than petechiae. So purpurea are greater than or equal to 3, petechiae are 1 or 2 Let's see picture. You can see here. This is petechiae, 1 or 2 and this is purpurea, which is 3 or greater than 3 This is petechiae, this is purpurea. This is petechiae and this is purpurea. It is believed that the capillaries of the mucus and the skin are particularly prone to rupture following minor trauma and that under normal circumstances, platelets seal this defect virtually immediately. Mucosal bleeding associated with defect in primary hemostasis may also take the form of epistaxis, nosebleed, gastrointestinal bleeding, or excessive menstruation, menorrhagia. A feared complication of very low platelet counts, thrombocytopenia, and intracerebral hemorrhage, which may be fatal. So, thrombocytopenia may cause intracerebral hemorrhage, which may be fatal. You can see here punctate petechial hemorrhage of the colonic mucosa, a consequence of thrombocytopenia. This is petechial hemorrhage, 1 or 2 in diameter. You can see here petechial hemorrhage in colonic mucosa. This is a picture of Robbins. This is fatal intracerebral bleeding. The intracerebral bleeding you can see it due to defect in platelet. Thrombocytopenia. This is corpus callosum. You can see it. Intracerebral hemorrhage. Second, defect of secondary hemostasis. Coagulation factor defect. Defects of secondary hemostasis coagulation factor defect often present with bleeding leads into soft tissue. Example, muscle or joint. Secondary hemorrhage often bleeds into soft tissue, muscle, or joint. Bleeding into the name arthrosis following minor trauma is particularly characteristic of hemophilia. That is, it may be due to clotting factor. Hemophilia A is clotting factor 8 deficiency. Hemophilia B is clotting factor 9 deficiency. So we'll discuss in chapter 20, 14 about all this. It is unknown why severe defect in secondary hemostasis present with this peculiar pattern of bleeding. As severe platelet defects, intracranial hemorrhage, sometimes fatal, may also occur. Generalized defect involving small vessel. Generalized defect involving small vessel often present with palpable purpura and ecchymosis. Ecchymosis, sometimes simply called bruises, are hemorrhage of 1 to 2 centimeter in size. Ecchymosis is 1 to 2 centimeter in size. Purpura was 3 millimeter in size, and petechiae was 1 or 2 millimeter in size. So remember size of these hemorrhages. These are very much similar, but there are differences. So in both purpura and ecchymosis, the volume of extravasated blood may be large enough to create a palpable mass of blood known as hematoma. So hematoma is palpable mass of blood. Purpura and ecchymosis are particularly characteristic of systemic disorder that disrupt small blood vessel, example vasculitis, or that lead to blood vessel fragility, amyloidosis, scurvy. Amyloidosis and scurvy causes blood vessel fragility, and vasculitis disrupt small blood vessel. This will cause purpura and ecchymosis. These are generalized defect involving blood small vessel. So this is ecchymosis, very much larger, about greater than 1 or 2 centimeters. Clinical significance of hemorrhage depends on the volume of fluid with the rate at which it occurs and its location. Rapid loss of up to 20% of the blood volume may have little impact in healthy adulthood. Greater losses, however, can cause hemorrhagic hypovolemic shock. So we will discuss in shock chapter. So greater volume of blood loss leads to hemorrhagic hypovolemic shock. Bleeding that relatively trivial in the subcutaneous tissue can cause death if located in brain. Because the skull is unyielding, intracranial hemorrhage may increase intracranial pressure to a level that compromises the blood supply or causes herniation of the brainstem. Finally, chronic or recurrent external blood loss, example peptic ulcer or menstrual bleeding, causes iron loss and can lead to iron deficiency anemia. In contrast, when red cells are retained, example in hemorrhage into body cavities or tissues, iron is recovered and recycled for use in synthesis of hemoglobin. So hemorrhage is within the cavity or tissue, the iron will be recycled. There will be no loss of iron. But if there is uh, a chronic or recurrent external blood loss, like if there is a peptic ulcer or menstrual bleeding, they will cause iron loss and lead to iron deficiency anemia. So this was all about hemorrhagic disorder. So in next video we will talk about thrombosis. Thank you.